Now, celiac is when your body does not absorb food properly into the gut. So with celiac disease, you might present with bloating, diarrhea, fatigue, rashes, and all of the symptoms. And what you notice is that when you eat certain types of foods that contain gluten, for instance, so gluten containing foods you can find in pasta, bread, cakes, flour, even your condiments like your jars or certain types of spices, they all contain gluten. So what you should do in this case is to keep a food diary. That will tell you what triggers are causing your diarrhea symptoms. To diagnose celiac, you are going to need a special test. It's usually done as a blood test as opposed to a stool test. So blood test, will show that you've got celiac. The doctors would advise you to actually not do a gluten exclusion during this period, because if you exclude gluten from your diet and you do a celiac test, then the celiac test is most likely to give you a false negative result. So in order to get a true and accurate result, you're normally advised to keep on taking gluten for as long as 6 weeks before the test. I know this is quite difficult because anytime you eat gluten, you're in so much pain, you're getting cramps, you're getting bloating, you're getting diarrhea, but this is essential to do the test. If your blood test comes back as negative and there's still a strong suspicion that you might have celiac, then usually you need further, more invasive investigation. So usually the doctor will want to take biopsies of your small bowel to be sent to the lab to help diagnose celiac disease.